Welcome to Chapter 11, Nursing Leadership, Management, and Collaborative Practice. Leadership and management are two terms I think we use interchangeably, but they are fundamentally different. Leadership requires a shared vision or direction for a group to follow, whereas management controls and directs people and resources according to principles or values that have already been established. Do you think we can have management that is effective without a strong leadership? It could be argued that when leadership and management align, we have what is called collaborative practice. Collaborative practice is when individuals work together towards mutually identified goals while valuing different perspectives and accountabilities of individual team members. In nursing, you will work with a wide variety of healthcare professionals, and effective collaborative practice is a vital aspect of achieving patient-centered care. When it comes to leadership, there are many different styles and theories for guiding leadership. The first leadership theory listed on this slide is transformational leadership. These are leaders who show integrity, and they know how to develop a robust and inspiring vision of the future. They motivate people to achieve this vision, and they manage its delivery, whilst building strong and successful teams. This type of leadership involves a strong understanding of emotional intelligence, which is the ability to understand and manage your own emotions and those of the people around you. There are 5 key characteristics of a transformational leader, and they include someone who builds trust, support an empowering work environment, create a culture that supports knowledge development, and they sustain change and build balance in competing values. Servant leadership occurs when the leader's main goal and responsibility is to provide service to their people. A servant leader focuses on the people that are directly below them, rather than the company as a whole. An example of somebody who implements servant leadership would be nurses. Appreciative inquiry, or AI, is a strengths-based positive approach to leadership development and organizational change. AI is about changing attitudes, behaviors, and practices through appreciative conversations and relationships. These interactions will help team members so they can imagine and jointly create a better future. Strength-based leadership focuses on recognizing what you and your team excel at, and they delegate tasks to those who are strong in areas where you are weak. And finally, quantum leadership. This is a type of leadership that considers the whole picture with smaller parts and is able to anticipate into the future. Nurses can assume a wide variety of management and leadership roles within healthcare organizations. The goal or vision of any management or leadership within healthcare is to ensure that patients receive safe and high-quality care. However, in order to achieve high-quality care, healthy work environments where nurses are respected and involved in decision-making is essential. There are many different management and leadership roles within healthcare. One role would be a senior nurse leader, or a charge nurse, or a practice lead. This is called a PL. These senior nurse leaders are responsible for planning, coordinating, and evaluating nursing unit activities. So this can include making sure there is enough staff, keeping track of discharges and admissions on the ward, and know how many beds are filled. Clinical managers oversee an entire unit within a hospital. They provide administrative support and oversee hiring and training of staff members. But they also liaise with patients and healthcare professionals. Finally, policy advocates are also known as clinical nurse educators, or a CNE, and they're responsible for aiding in the development and distribution of new policies. If there is new research that has led to a change in a policy, the CNE is responsible for educating staff on the changes and providing education when necessary. An example of a recent policy change in healthcare is the use of masks due to COVID-19 pandemic and the changes in PPE equipment as a result of the PPE shortage. Nursing care delivery models are designs that determine how nursing care is provided. And regardless of how nursing care is provided, the most important concept of any nursing care delivery model is continuity of care. Continuity of care refers to a seamless and continuous implementation of a plan of care that is reviewed and revised to meet the changing needs of a patient, regardless of the nurses or any other healthcare providers providing care to that patient. So nursing care delivery models provide a framework for how nursing care is provided, and these typically fall under two different models: traditional models and emerging models. First, the traditional models. Functional nursing became popular during the nursing shortage in World War II, and nurses focused on tasks instead of having assigned patients. They simply focused on tasks. This leads to obvious problems in continuity of care. Team nursing developed in response to the nursing shortage after World War II, and it involves the coordinated delivery of nursing care by various staff members. This is still common in long-term care today. For example, an RN typically leads a team. An LPN provides nursing tasks such as medications or dressing changes, and a care aide provides hygiene care for the residents. This nursing delivery model works in that there is collaboration to get all the work done, but it still struggles to maintain continuity of care. Primary care is aimed to place nurses at the bedside and improve nursing accountability for patient outcomes and relationships amongst staff. An example of a primary care model would be one nurse to one patient, and when the primary nurse is off duty, care is transferred. Emerging models can include case management, and this emphasizes the coordination of a variety of health services and links them to patients. This is often done in the community and also involves a case manager. Finally, collaborative practice. This model is similar to case management in that an RN is typically providing care to patients across different settings, but the RN connects patients with a variety of healthcare professionals. These can be called interprofessional teams. And these teams can include doctors, nurses, pharmacists, dentists, social work, mental health therapists, and others who learn with, from, and about each other to enable effective collaboration. As a nursing student, you develop the skills necessary to ensure timely and effective patient care. While you might start off with only one patient, you will gradually add patients to your workload, and you'll have to use clinical decision-making, priority setting, time management, evaluation, and delegation to help coordinate your care between patients. Clinical decision-making requires some critical understanding of different patient perspectives, using your own knowledge and evidence-informed practice. Priority setting requires a nurse to use judgment in choosing a course of action for patients. When you think of a priority, you want to think of your airway, breathing, circulation, and patient safety. Time management reflects how a nurse uses his or her time to plan effectively and constantly be aware of the competing priorities within nursing practice. Evaluation is the most important aspect of clinical care coordination, and this is an ongoing process that provides focus and direction for nursing care. And finally, delegation requires a nurse to understand the different roles within nursing and of other healthcare providers to delegate tasks appropriately to ensure the safety and quality of nursing care. Unregulated care providers are frequently called care aides within our healthcare system. They are called unregulated care providers because they are not under the same regulatory body as nurses. This would be the BC BCCNM. Care aides or unregulated care providers typically work in home care, institutional acute care, so this would be with patients awaiting long-term care in acute care, and long-term care facilities. Care aides or unregulated care providers are specialists in personal care and other tasks that might be assigned to them. Delegation is an aspect of clinical care coordination. And delegation is when you assign a task to another person or healthcare provider. This means that it is essential for you to be aware of the different roles and scopes of practice of other healthcare providers. This can vary within different practice settings and can be dependent on provincial and territorial regulations, as well as institutional policies. As a student, it can often feel overwhelming to get all your tasks done. This is where delegation can be helpful. It is a skill to recognize when you need help and how to ask for this help. This is not asking a person that you classify as a lower scope of practice, such as a care aide or LPN, to do your shit jobs. It is also important that you perform an assessment on the task you are trying to delegate. You need to assess the client's health status and care needs, the right context, which would be the care environment and resources, the right intervention, and the right person. For example, you would not ask a care aide to do vital signs on a crashing or unstable patient. The patient health status is unstable. It is not the right setting for a care aide. The intervention is not within the care aide scope, not in Northern Health anyways, and this is not the right person to delegate this task to. When it comes to leadership and building a culture of safety, what I ask of you is to be a role model and leader in the care you provide. Always use best practices as a nurse to ensure optimal patient safety. Patient safety is a critical component of healthcare delivery. And this culture of safety is basically the reduction and mitigation of unsafe acts within the healthcare system. And it uses best practices to lead to optimal patient safety. While you might not want to call yourself a leader as a first-year nursing student, there are many skills you do possess as a student nurse that demonstrate leadership. Leadership can be something as simple as advocating for a patient. Maybe you've determined a patient is unsafe to get out of bed because they have no grippy socks and no shoes. And so you advocate for that patient to stay in bed. It could be recognizing that you need help, and so you ask for it, but through delegation. It could even be something like mentoring another student nurse through something that you've already experienced. Ultimately, leadership is not always grand gestures that change the world. It can be something small in everyday life that has to just change the world for one person.